right, wonderful, and welcome everyone to our October Brunch and Learn for 2025. So excited to have this time to be with you all today. My name is Dr. Japera K. Barnes, and I'll be serving as your host. Always warmly welcoming everyone who's joining us live in our Zoom call. And to those who are watching on LinkedIn right now, welcome. We are so glad that you are watching and tapping in as well. Our YouTube audience, you're in the building too. So welcome. We're so glad that you are here as well. And I'm excited for today's conversation. I'm excited like every single month that we do this, right? Third Thursdays of every month, the qualified takes the time to find awesome professionals working in the health information space, coding, revenue cycle, compliance, all of the places and all of the facets of health information. And we pull, and these people are willing, these professionals are willing to come and talk to our audience and share with us their expertise and knowledge. And today is no exception. We have an outstanding, very amazing woman who will be presenting to us today. We're talking about going beyond compliance and how to build your expert coding foundation with regulatory frameworks. All of our compliance and revenue cycle folks in the building, you right at home. You're going to feel the energy today, okay? All right. So I'm going to tell you a little bit about Clarice, but first I'm going to tell you a little bit about the Qualified. We want you to visit our website, that's a hyphen, qualified.com. We are dropping it in the chat right now for you to learn more about what we provide. Not only do we provide educational opportunities every single month, but as an educational company, we help you get certified if you want to gain more credentials within the health information space, earn more credentials, earn more money, and expand your professional reach. We can help you with that. We also provide tutoring services for those who are seeking a certification exam. You have some time that's coming up and you need to get prepared for that certification. We can assist you with that. Let's turn to the job market for a little bit, right? We get to help employers find qualified health information professionals. And if you are seeking employment, we can help you with that as well. So we provide a wealth of services, so much to talk about, but we have our website in the chat box for you so that you can visit us and learn more about our programs, and we are happy to serve you. Okay, so let's get into today's presentation. A little bit of introduction, little formalities. Okay, little formalities. I want to introduce you, everyone, to Miss Clarice Warner. She has worked in the healthcare industry for over 30 years. She has gained experience in revenue cycle management, including medical billing, auditing, compliance, billing, and more recently, she's tapped into health policy. Now, Clarice is a RHIA, Registered Health Information Administrator. She is a certified coding specialist, physician-based specialty. She is a certified professional coder. She's certified in healthcare compliance and so much more. As a seasoned revenue cycle consultant, Clarice is passionate about compliantly advancing the success and significance of individuals and organizations. She has worked in academic medical centers. She's integrated healthcare facilities and hospitals, physician practices, and even skilled nursing facilities. So what am I saying? I'm saying she's coming to us with a wealth of experience and exposure. She has also worked with behavioral health organizations and qualified residential treatment programs. Now, in addition to education and training, Clarice is also involved in advocacy and professional development. She holds a master's degree in public health from George Washington University. She got her bachelor's in health information management from the University of Cincinnati. And outside of the office, Clarice is a very interesting individual. I believe she's interesting in the office, but she's also interesting outside of the office. Why do I say that? Because she enjoys creating social media and educational content. She enjoys videography. She's also a line dance instructor, a podcast host. You could tap into her podcast, The Saturday Morning Tea. Saturday Morning Tea, and I hope that she'll share some information with us on how to tap into her Saturday morning podcast. Been going on now for over 5 years, y'all. So welcome, everybody. Go ahead and send out the emojis, the responses where you are clapping your hands and making all the noise for Miss Clarice Warner. Thank you so much for joining us. We turn it over into your hands.
Hey, well, thank you. Thank you. Such a warm, warm reception. I see the claps and all of the things. I love it. I love it. Well, good afternoon, everyone. Everyone. Thank you. Well, not quite afternoon, I guess. We're still in the morning, huh? Good morning to everyone. Well, depends on where you are in the world, but thank you for joining me today. Today, we're going beyond just following rules. Compliance, most people think rules, they think, oh my God, here we go. But no, we're going to go beyond just following the rules. And we're building the expert foundation that transforms good coders into indispensable professionals, because that's what we are. We are professionals in this field. Now, I was already introduced, so I don't even have to go through all of the things, but I just want to mention that I've spent my career at the intersection of coding accuracy, regulatory compliance, and now adding the public health outcomes as well. So people thought, well, wait a minute, none of that really makes sense to separately. Why are you bringing it all together? I was like, because I saw a vision. I saw some things that others didn't see. I can see how it's all interconnected, and that intersection is great. And we are all part of that intersection if you are involved in health information. So we're going to talk a little bit about that today. But before we dive into the frameworks, I want you to think about something bigger. So these are the learning objectives. The educator in me comes out. These are the learning objectives that we will tap into today. These regulatory frameworks, the ones that we're going to talk about today, aren't just bureaucratic requirements that make our jobs harder. No, they're actually the infrastructure that ensures healthcare data integrity. Think about it. The data we generate through accurate coding drives everything from clinical research that develops new treatments to public health surveillance that prevents disease outbreaks to quality improvement initiatives that saves lives. When we code accurately within these frameworks, we're not just avoiding audits, we're contributing to better patient care and population health outcomes. Now, here's why this matters to your career. Mastering these frameworks distinguishes you from coders who just follow the rules versus those who understand the why behind them. And employers, well, they pay premium salaries. And we always about getting to the bag. Premium salaries for coders who can work independently and minimize compliance risks. So today we'll cover 4 foundational regulatory frameworks. Each one comes with real-world scenarios and practical applications you can use immediately. So by the end of our time together, you'll have a comprehensive toolkit that positions you as a strategic professional, not just someone who assigns codes. So are you ready? Okay, well, let's begin your expert foundation. Let's start with the framework that touches every single code you assign, CMS guidelines. Medicare was established in 1965 and initially just for our population 65 and older. But watch what happened over the decades. In 1983, the introduction of the DRG system revolutionized how hospitals got paid. In 1992, it brought us the RVRVS system that standardized physician payments. But here's what's fascinating. Today, CMS policies influence all payers, not just Medicare. CMS has evolved from a government insurance program to the de facto standard setter for the entire healthcare industry. So here's your key principle. CMS guidelines are your true north. When you're in doubt about anything, this is your most reliable reference. So let me give you 3 ways this plays out in real life. First, private payers typically adopt CMS guidelines within 6 to 12 months. Sometimes, they like to drag their feet and unsure, and they interpret things a little different, but usually they jump on board. Second, quality reporting requirements almost always mirror CMS initiatives. And third, when auditors come knocking, they frequently reference CMS interpretations as the standard. Now, let's put this into practice. Here's a scenario, and I want you to think about CMS updates its guidance on remote patient monitoring documentation requirements, making them more stringent than before. You're a coder at a cardiology practice, and you notice your commercial payers are still accepting the previous, less detailed documentation standards. Quick question. Should you code differently for Medicare versus commercial patients? I'll be looking for y'all in the chat. Y'all can put y'all answers in there. All right, I see. I started to do a whole little poll thing, but then I thought we might, with so many ones that I put in here, we might get bogged down in time. So I was like, well, we'll just use the chat. The professional response is to use CMS as your standard across all payers. So those of you who said no in Medicare, you're on to something. You're on to something. Here's why this protects you professionally. It demonstrates consistent quality standards. It builds credibility with auditors who expect CMS level rigor. And it positions you as a knowledgeable professional who understands where the industry is heading. So, your first professional toolkit item, CMS guidelines, provide your authoritative foundation for all coding decisions. When you master CMS standards, you're not just coding correctly, you're coding strategically. That's your compass. Now, let's talk about your risk management system. The Office of Inspector General, your systematic approach to navigating ethical and compliance challenges. So the OIG was created in 1976, initially focused on catching fraud after it happened. But in the 1990s, something smart happened. They shifted toward prevention through compliance programs. The year 2000 brought us the first compliance program guidance for hospitals. And today, we have comprehensive guidance across all healthcare settings. Here's the evolution that matters to you. OIG moved from, quote, catch the bad guys to help organizations build effective compliance programs. They want to help you succeed, not trap you. If you know anything about the government, they give you the playbook. They tell you exactly what it is that you're supposed to do. It's up to you to make sure that you know what it is and that you follow it. And they're giving us, as I said, a roadmap, 7 elements of effective compliance. Let me walk you through these because they give you a systematic approach to navigate any ethical or compliance dilemma you face. Written policies and procedures, a designated compliance officer, effective training and education, effective lines of communication, monitoring and auditing, response to detected violations, and corrective action. For coders, these elements transform you from someone who reacts to problems to someone who proactively manages risks. And of course, that's what we're trying to do, right? Right. Okay, let's see this one in action. You receive an operative report for a complex spinal fusion, but the surgeon's documentation is unclear about the number of levels that are fused. You know how documentation can be, right? The case could support either a lower paying or a higher paying DRG. The physician is in surgery and unreachable for clarification. So what do? I'll check your chat. Think about it. What do you do? What do you do? Well, if you're using the OIG framework, you have a clear path forward. First, you identify the issue. You have ambiguous documentation creating reimbursement risk. Second, follow written policies. So check your facility's policies on documentation queries. Third, document your process. Record the ambiguity and the steps you're taking. Fourth, Communicate appropriately. Use your established channels to reach the physician. Fifth, code conservatively. When in doubt, choose the option with the lowest risk. And sixth, monitor outcomes. Track similar cases for patterns. Mhm. So, this approach demonstrates due diligence and protects your professional integrity. Supervisors trust that coders who can handle complex situations systematically rather than just guessing or hoping for the best. Your second professional toolkit item is the OIG guidelines. They transform you from a reactive rule follower to a proactive risk manager. You become the person others turn to when situations get complicated. So now we got the risk management covered. Now let's talk about your authoritative references. And if you have any questions as we're going along, feel free to put them in the chat. We'll we'll definitely have a Q&A at the end, but if there's something that comes up while we're moving through the presentation, we'll definitely take a look at them. So, the American Medical Association, or AMA, CPT editorial panel was established in 1966 to maintain the CPT code set. They have a rigorous process for code additions, revisions, and deletions. I love going to their symposium every year just to hear why they want to add this and the reasoning behind it, and even the clinical significance of the ad. Um, it's a great time. Time had by all. So when they make a decision, it becomes a regulatory standard, not a suggestion. You also have the American Hospital Association and the Coding Clinic, and it provides official guidance for ICD 10, CM, and PCS coding. So this is developed in collaboration with CMS and the Centers for Disease Control and Prevention, and it carries binding authority for Medicare and most other payers. They also have um, a webinar type session where you can hear the reasons behind the ads into ICD-10 and PCS. Why should we add this particular procedure? They have clinicians come in and talk about what procedures they're using, the new diagnoses that are being developed, all of the things. So it's a way for you to be ahead of the game, if you will, because they're talking about this today, but it won't go into practice until a year from now. So you get a heads up on things that are already in action. And I always believe in being on the reactive side or on the proactive side versus the reactive side. And this is a perfect way to do that. Here's what I need you to understand. These aren't suggestions. They're your professional standards that define competent practice. Why does this matter to your career? 3 reasons. First, it demonstrates current knowledge and competency. You're not just winging it. Second, it provides defensible rationale for your coding decisions. You can explain exactly why you made each choice. And third, it's required for maintaining your credentials and continuing education. So let's make this real. Oh, let's see. I see a question. Sorry. So, how do we find these meetings? Would love to be more proactive. Great. Now, the CPT symposium is usually held in November. It used to be in the very chilly town of Chicago in November, but once the world went inside, it turned into a virtual meeting. And so they have it every November. I want to say it is like the 18th, 19th, but don't quote me on the dates. But it's every November. It's brought to you by the AMA. So if you go out to the AMA website, you can get more information there. It's a little pricey, but oftentimes providers or organizations will pay for because they know the value. And you get a copy of the next year's CPT book as well as the CPT changes book. So that in and of itself kind of reduces the price, at least for me. um, the coordinating and maintenance committee meetings from CMS is for your ICD-10 CM diagnosis changes and updates, as well as PCS. They usually offer these quarterly. We didn't have one in March, but we had one or they were quarterly. I think they're going to twice a year. We didn't have it in March, which we usually do, but they had one in September. If you go out to the CMS website and look for the ICD maintenance and coordinating link, there's a link there. You can find the information about prior meetings that they've had, and then you'll find information about ones that are coming up. This is completely free. There is no charge for it. You also can get CEUs both from AHIMA and AAPC for the live session. They don't grant CEUs for you to go and listen to the replay, unfortunately. Usually it's a 2-day event. So one day they talk about all of the diagnoses, and the next day they talk about the procedures. And you have the clinicians there who will actually walk you through the rationale behind why things are needed. You also have CMS professionals who are there to talk about the regulatory pieces. And you also have other coding specialists who are there who kind of said, okay, that sounds good, but we already have this. Or what about the not elsewhere classified? Well, we already have that. So wouldn't that be part of that? So they kind of not necessarily debate it, but have a lively, robust discussion about whether something should be added or how it should be added. And then if it's not decided or determined at this time that it should be, then they can go back and reflect and try again. It's a great time. I love it. Again, it's free of charge. So just check out the CMS website on those. You're welcome. You're welcome. Okay, so let's make this one real. The American Hospital Association coding clinic publishes new guidance that contradicts how your facility has been coding wound debridement procedures for the past year. Your supervisor says, well, we've never had problems with audits, so let's keep doing it the old way. What would be your professional response to that? I'm looking on the side because this is where I see all the questions. So I'm looking to see, do we have any questions? Okay. Well, first, you educate your supervisor on the authoritative nature of coding clinic. Again, this isn't optional guidance. Second, document the guidance change and your facility's response. Protect yourself. I tell people this all the time because oftentimes you may be at a facility or you may be at, especially with smaller practices, and it's like, either you do what we tell you or you no longer work here. And so I tell folks to always document, not only documenting for the care that's being received, but as an employee of certain organizations, you need to document what's happening as well. We all have heard how not only are ultimately the providers are responsible for things and the claims that are being submitted, but they kind of turn left when they say, well, wait a minute, I had a coder who actually coded it this way, and they knew more about it than I did, and I trusted them to do da 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 da, which is the truth. Unfortunately, that coder probably had a director or a supervisor that told her or him something else. And so they were following that directive. Again, coder, document. When you see something that does not feel right, sound right, smell right, but you feel compelled to keep your position, if you will, make sure you document that and document the reasons why, so that you're covered. Because then you can say, well, wait a minute, on such and such date at such and such time, Supervisor Jane told me that this is the way we do it, and this is the way I needed to continue to do it. And then that way, it's off of you, and then now they're looking for Jane. So make sure you document and protect yourself. Third, implement more correct coding moving forward. You have a professional obligation. And fourth, suggest a retrospective review if there was significant volume affected. Here's your career protection. Following authoritative guidance protects your credentials and demonstrates professional competence. In any audit or legal proceeding, you want to be on the side of official guidance, not facility convenience. So document. So this is your third toolkit item. Professional organizations provide the credibility that separates coding technicians from coding professionals. When you can cite authoritative guidance, you're speaking with the voice of the entire profession. Authority established. Now let's talk about your ethical foundation. HIPAA and privacy frameworks, your guide for balancing innovation with professional responsibility. So HIPAA started in 1996. Everything happened in the 90s, didn't it? With the focus on portability and administrative simplification. And I was right there in the thick of it. The privacy rule came in 2003. Then the omnibus rule updates the business associates in 2013. Today, we're dealing with the intersection of privacy requirements and emerging technologies. And those challenges are real, real, real. Telehealth documentation and coding, AI assisted coding tools, cloud based systems, data sharing requirements, remote work environments. The landscape is changing fast, faster than we can keep up oftentimes. But here's what privacy frameworks do for you. They help you balance innovation with professional responsibility. You're not the person who says no to everything new. You're the person who knows how to implement new things safely. See that twist on those words? It works out. I love that. 4 key principles for coders. The minimum necessary standard applies to your coding work. You need access to what's required, not everything. Business associate requirements affect your vendor relationships. You need to understand these when new tools are introduced. Documentation requirements serve both reimbursement and privacy goals. They're not competing interests. And security safeguards protect both patient data and your professional liability. There's a lot of things going on in the background. You think you're just doing one little thing, but there's a whole machine that is involved. And it's really imperative that we are in the know about that machine. So let's put this one to work. Your facility is implementing an AI coding assistant that flags potential misdiagnoses and suggests additional codes. We all been there and we know what that looks like. The vendor wants access to full medical records for, quote, better accuracy, but your IT department raises HIPAA concerns about data sharing and storage. What are your professional considerations here? What do you think regarding this? Mhm. I need music. All right, all right. Well, first, let's evaluate the vendor's business associate agreement. And are they actually qualified to handle this data? Second, assess the minimum necessary principle. Does the AI really need full records to do its job? Third, document your decision making process. Again, there's that word, document. Whatever you decide shows that you thought it through professionally. Fourth, establish clear audit trails for AI suggestions so you can track what's working and what's not. And fifth, maintain human oversight and final decision authority. You're still the professional making the coding decisions. Here's your career value. Professionals who understand privacy frameworks become trusted advisors for technology implementation. You become the bridge between coding needs and compliance requirements. You're not just adapting to change, you're leading it. Your fourth professional toolkit item, privacy expertise, positions you as a strategic asset, not just a coding resource, right? Right. So you got to walk in, shoulders back, head up, knowing what you know. You know what you know, what you know. So let folks understand and see that you know what you know, what you know. Now that we've explored each framework individually, let's see how they work together to create your comprehensive professional foundation. Again, these four frameworks don't operate in isolation, not at all. They create a comprehensive foundation for professional excellence. CMS provides your technical standards and shows you where the industry is heading. The Office of Inspector General, or OIG, gives you systematic risk management processes that work in any situation. Professional organizations offer binding authoritative guidance that backs up your decisions, and privacy frameworks ensure ethical and legal practice as technology evolves. Together, they transform you from a task oriented coder to a strategic professional. You're not just someone who assigns codes, you're someone who understands the system and can navigate it expertly. Let's talk about what this means for your career advancement. You're now positioned for compliance committee participation, training and mentoring responsibilities, clinical documentation improvement initiatives, and technology implementation teams. That's a whole lot, right? And knowing that you are now positioned for those types of transitions in your career allowed you or afford you the opportunity to do some uh, rethinking about the value that you bring to your organization, rethinking your career path. As we've lately heard a lot about AI and what AI is going to do to, for, and with coders, this provides an opportunity to consider, well, I do a lot more than just coding. Or do you? But you should. And if you are and can speak truth to power, then you also need to let folks know that these are additional things and these are additional skills that you're bringing to the table because you have done these types of tasks and you have the skills for these tasks. The other thing is when advancing career opportunities is make sure that your resume is updated to show what you've done, what you know, and how you have advanced from a coder doing some maybe simple coding tasks to one that now deals with more complex cases, one where not only your peers see, know, and trust the information that you provide, but you're also getting the attention of senior leadership, middle management leadership, as well as senior leadership. They're taking notice that, well, wait a minute, you are now becoming the go-to person. You are now becoming the person that they can ask questions and trust and believe that the information that you're providing is correct. That's the type of leadership pathway or career advancement pathway that we should be thinking about. And remember, there's the salary impact. I told you we always give back to the coins in the bag, right? So employers value coders who can work independently, minimize compliance risk, and interface confidently with physicians and auditors. So it's one thing to, and I think once upon a time, people thought, oh, I just want to be in this field because, well, I'm hearing now from brand new people coming into the field. Oh, I just want to work from home. Ma'am and sir, it's way more complicated than that. And I have to kind of reel them in and give them a whole spiel. But we're not just the people in the little basement offices anymore. And even if we are working remotely, we can still show our worth and show our value. When we're having our regular team meetings or we're having our regular Zoom get togethers, speak up, talk through, just talk truth to power. You know the information. Let folks know that you know the information. Um, that gets attention. So while you can't well, in some cases, it depends on if you're working from home. But if you're in the office, you can walk in and hold your head up and say, "Well, wait a minute. I know so and so and so and so, and here's the information to support the reason why I'm suggesting XYZ." We got that. You can do that same type of exercise remotely. They're having some conversation about a new regulation or a new guideline. Well, wait a minute. I saw that CMS is also stating that we need to make sure we're doing XYZ. And everybody be looking at you like, well, wait a minute, where did you get that? And you keep talking. Yes. And if you go to such and such and such and such on page so and so and so, you'll find that information. And then so folks be like, okay, well, one or two of those gets some attention. And so, which also can ultimately equate to additional career advancement and increase salaries as a result. So again, these frameworks are your evidence that you can do it all. You can do it all. Yes, all are important. So when you encounter a complex coding situation, you now have a systematic approach. First, check CMS guidance for technical standards and industry direction. Apply the OIG risk management principles to protect yourself and your organization. Reference authoritative professional guidance to back up your decisions and ensure privacy compliance throughout the entire process. Again, this approach demonstrates professional competence and protects your career. You're not guessing, you're applying expert knowledge systematically. And I know I hear a lot. Well, Clarice, we out here in the front lines doing this coding, and um, we have productivity standards that we have to face. We have, a massive queue that we got to get through. They're pushing us and pushing us and pushing us. When will I have time to do any of this? Well, one thing that you must know, should know, somebody should have told you a long time ago. In this particular field, and I'm sure as you have come and visited with the qualified on their monthly brunch and learn and educational topics, we are in a lifelong learning career. Every day you're learning something new. I mean, peep this. Every year, well, it used to be annually, but now it's gone to twice a year. So you get new guidance, new codes, um, new guidelines. You get all kinds of things on a regular basis. With our current administration, we've started seeing things come probably daily now, where one minute you're told to go left, the next minute you're told, you need to go back right. And then you told, well, you know what, you just need to walk out the door altogether. So you never know where you're going and how you're going. But you have to make sure that you're keeping track of at least have a working knowledge of what's happening. You may not get down to the nitty gritty all the time, but at least be prepared, be mindful. listen to, like the different organizations that, especially if you are in, if you're working in a specialty, know who the authoritative specialty folks are, that will provide you with some of the key areas. Like when the guidance comes out every year, like the physician fee schedule or the inpatient prospective payment systems, those can be thousands of pages long. And who really has the time to do that? But first of all, know that we have some AI tools that we can use for ourselves. It's a PDF. Plop that PDF over into your favorite AI system and ask for a summary of the key points, or ask for a summary of things that you need to know in a particular specialty, and let it spit out for you. And then, verify and check and make sure, because AI can AI, verify and check and make sure that it has what it is that it needs to have. So then that you can take that information and with confidence say, okay, well, this is what's coming. This is what the final rule says. This is what we need to do. And then you have some working knowledge. You have some additional um, a checklist, or you have additional guide that can tell you, okay, this is how I need to not only inform my team, but let's make sure that our team or our working group informs those senior leaders or those who have a direct connection to the bottom line of this particular organization, because things may and can change, but they may not know that. That's you. That's you at the front line of what's happening. Um, and so going back to being a lifelong learner, sometimes, we may have to take that weekend and do some research. We may have to put on our education learning hat and be like, you know what? Instead of scrolling on TikTok for 15, 20 minutes, let me take 15 to 20 minutes and look and see what's going on at CMS. Or let me take 5 or 10 minutes to see, or, they got uh, um, LinkedIn pages and YouTube pages and Facebook pages. You don't even have to go to their websites anymore. You can just go to the pages and follow them and let them bring the information to you. So there are all kinds of ways to kind of keep up um, with what is happening, even as a frontline coder who may be faced with challenges regarding productivity demands and the like. So you can still do it. I know we like to be spoon fed things a lot, but um, me personally, I like to see it in black and white. I need to see. Yeah, you can tell me whatever, but where did you get this from? I need to see where you got it from. And then if I trust and believe it, then, hey, we good, and we can move forward, and we can share with the masses. Okay. All right. So these are some of the approaches that you can use um, when facing those complex coding situations. So let me leave you with this. These 4 frameworks aren't just regulatory compliant requirements that make your job harder. No, they're your professional differentiators that make your career stronger. Again, it's a lot of noise happening in the world of health information. I just got home yesterday from AHIMA 25, and it's a lot of noise out here around our profession. It's a lot of noise out here about what we can and cannot do, what we should and should not do. It's just a lot of noise. And so at some point you gotta rise above. You gotta show what you're made of. You are provided with the information. You have certifications, you have degrees, you have skills, you have all of the things. Show the folks what you got. Show them what you're working with. Right? Right. So showing them what you're working with helps you become stronger. So also, I've always said that there's a why to all of this. There's a why. And oftentimes people don't know why. They don't know why I need to assign this code to this. Well, somewhere, probably back in the 90s, as we've discussed today, but somewhere Someone said, well, no, this needs to go with this. And this is due to this type of procedure because we've changed how we used to do that procedure. And now we got new tools that allow us to do this. And so this changes all of that. So now you actually need to use this code. There is a why behind all of that, all of the change that we encounter on a regular basis. There is a why. And you need to understand the why behind the rules. You become the coding supervisor's trust with complex cases when you know the why. You become the professional's physician's respect for clinical knowledge. Again, when you know the why, because they ain't got time for that. They seeing patients, right? They need to trust that you know why you're telling them, sorry, ma'am, you need to make sure that you're documenting da 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 da. Otherwise, we may get paid this, but we could get paid that. They need to trust that you understand what is happening and what is going on and respect the clinical knowledge that you bring to the table because we do have we may not put hands on people, but we still have clinical knowledge. I still think we are all clinicians because we had to sit elbow to elbow with nurses when we were learning all of these things in health information. So we too are clinical. We just don't put our hands on folks. Also, you become the expert auditors view as competent and credible. So when auditors come into the room, and I've been an auditor, so I'm listening and looking for the people that I can talk to. And so if I feel like, oh, wait a minute, this one right here, he or she knows what I'm talking about. They're nodding, they're shaking their head, they are asking questions, they're inserting, they're even supporting and defending some of the things that we're having conversations about. I know that this person right here can have a conversation, and auditors respect that because then they're looking for, well, wait a minute, well, where's Tina? Because last time I was here, Tina was here, and Tina and I could help. Tina can help me get the information across to the rest of y'all. So where is Tina so I can talk to her? So again, you become the expert. Folks are looking for you. Folks are checking for you. So make sure that you use your frameworks, get these professional differentiators and be the person that folks are looking for. So here's my challenge to you. Pick one framework from today and dive deeper this month. Yes, make it your area of expertise. Subscribe to the CMS updates. Read the latest quarter coding clinic. They come out every quarter, right? And if you have you can, well, they're subscription based, so you can have your own personal subscription. But oftentimes, if you're working in a facility and you have an EMR system or an encoder system, the coding clinics are built in there. Go dig for them. You can get them for free using your employer's tools. So use the tools that they provide you. Check them out. They're there for you to operate and do the best job you could do. Take a compliance course. Y'all know YouTube University has all kinds of things going on for free or low cost. You have to keep up with your CEUs and credentials. What's a better way to do it with something that you are interested in? So be on the lookout for different things that can help you dive deeper and help you strengthen your career. Or you can also research privacy requirements for new technologies. And that is a very, very hot topic. Again, all the buzz about AI, all the buzz about all of the things that are happening in the world. Now is the time to be, again, in the forefront of some of that. I mean, the train has left the station. It's coming, whether you're ready or not. But why not be ready? Get ready, stay ready, so you don't have to get ready, right? So let's put it into action. um Again, I thoroughly believe, these things, you've heard these things, but sometimes it's in passing or somebody is just sharing that information. Just make sure that you are ready to be able to show your worth. Show your worth. Again, your career will thank you. All right. So let's stay connected. How about that? Let's see. Do you have any questions? Oh, I love that. Thank you. So did I get a picture of the slide? Well, actually, if you scan the QR code, you'll actually get uh, presentation, the PowerPoint presentation. But are there any additional questions? I'm looking out here in the. Or is there anything I might have missed?
I don't see any in our chat, Clarice, but oh my goodness, this has been awesome. Y'all take the time to ask any questions or pose any questions in the chat for Clarice. I think this has been inspiring, motivational. It helps to push us, no matter what position we find ourselves in. It helps to push us to tap into more resources.
Absolutely, absolutely. And I remember coming into the field, and it's like, well, you would have, Lord, I'm dating myself, but you would you would have, the coders, you had the general coders, you'll have your specialty coders, and then you would have like your supervisors or team leads or managers. And we would have these team meetings where the managers would come in and they would tell you about all of the changes and all of the things. And I would always be like, well, how do they know this? Where are they getting this information from? And lo and behold, me and my little inquisitive self uh begin to dig. Oh, wait a minute, hold up. So when they come in with their stuff, I'm like, well, you know what? They did change that. So, you've given us some old stuff. I need the most current and most recent things. And then they would look like, well, how would you know? Because I've been looking too. And I go to the sources, go to the source. Like I said, CMS is your source, the OIG is your source. And the thing about this is it especially in putting on my compliance hat, it just behooves me that folks, and I'm speaking the organizations and those who are the decision makers. Folks get so twisted and turned up about, well, we this rule, and why are they denying this, and why are they doing this, when they've already told you, they have given you step by step what it is that you need to do in order to get your stuff paid. But folks they just won't do right to save their lives, right? So you have to then say, okay, well, they've already told us what it is that we need to do. Here are the steps. Have we done that? And then that's when it gets real quiet in the room and they're crickets. But again, showing them they're not trying to come after you. They're trying to tell you, they're trying to help you make sure that you're doing things right. So when they do audit, because they will audit, I mean, you know how we do. We want to make sure and check and make sure everything is okay. They're going to do the same thing. If I give you my money, I need to make sure that what I'm paying for is legit, that it's authentic, that it's real. And so this is the same approach that they have. Okay, I'm giving you the money. I'm paying you for the services that you said you were providing. Well, did you provide it? Show it to me. Show the receipts. They just want the receipts. But again, they tell you what it is that you need to make sure that the receipts are valid. And that's where, the confusion and the tension and the, oh my God, they're coming after us, and oh my God, they're doing this. No, they've already told you what to do. You just chose not to do it. Now, whose fault is that? Okay.
And she's going
Listen,
in.
I know. You see, it only take a minute, right? Okay, Heather says, what steps or advice from your own career path that you would give to someone trying to transition into healthcare compliance from being an HIM manager? Ooh, so again, think about all of the things that you've heard from management. Think about the players in the room. Think about where your work sits in health information, in the revenue cycle, even as a whole, and who all does the stuff that you're doing, who all does it touch? And then think about how it's touching them. And if you don't know them or don't know specifically the role that they play, or understand how what you provide them impacts what they do, have a conversation. But then always go back and say, okay, I know I got my CFO, I got the director of finance, I have the director of risk, I have the director of quality, I have the director of all these people. And then take a look at the OIG work plan. Start there. Always an easy one. And look and see what type of, and again, my friend over in the AI world, you can take and say, okay, I'm looking for recent uh, uh, guidance on risk assessments on a certain type of procedure or something that you do in your facility. And then you can take that information and then have a conversation and say, you know what? Um, I think this is part of compliance. I think this is part of what we do. And if you're not 100% sure, reach out to your compliance officer or reach out to someone in your compliance team. Now, hopefully, someone in compliance and someone in HIM are already linked. That one is a no-brainer because everything that happens in HIM impacts the organization. Everything. So there should already be some sort of conversation or some sort of communication about what's happening. And then start looking through the audit requests. Start looking through some of the even the denials. Start looking at some of those things and then kind of reverse engineering. Well, why are we being denied? What is happening? What does the guidance say that we're supposed to do? And that's how you're building your compliance muscle, because really that's really all we do. We kind of look at what's happening. We identify what the problem is. We understand or get the information to support what this problem is and how we can potentially fix this problem. Once we fix the problem and understand what needs to happen, then we begin the education. And then telling folks, okay, in your role, this is your piece of the problem that you own. And in your role, this is the piece of the problem that you own, and putting all of those things together. And then discussing, well, how are we going to go from what we used to do to what we are supposed to be doing now? And what does that corrective action plan look like? And then making sure we follow that, and then come back a little bit later, a couple months later, and then take a look and see, are we still doing what we're supposed to be doing? That's all compliance really is in a nutshell. And you probably do that every day in your HIM world right now if you're an HIM manager.
Hey, Clarice, thank you so much. So there's a question, an earlier question from Heather. She wants to know how beneficial is the CHC exam as a fellow RHIA trying to become a compliance officer?
Well, that exam is no joke. Let me just say that. But there's a there is a book that comes from HCCA that kind of walks you through all of the things, and really it's kind of like a study guide. And I would make sure if you're really ready to sit for that exam, just make sure you go through that. They do have those academies. If you are afforded the opportunity to go through an academy, I would recommend that as well, because you're you're locked in for 3-4 days and you're focusing on all of the things, preparing for the test. And then at the end, you sit for the exam. There is not a lot of coding specific type of questions, but you need to understand, again, the why behind coding. So it ties coding and the coding skill to regulatory and the guidance. And so you need to be, and especially everything CMS, you need to really know. If you don't necessarily know, well, where can I find it? And that there are a lot of scenarios. Some of the things like we did today in this presentation, there are a lot of scenarios based on that. So given this type of situation and knowing what you know about the regulations and the guidelines, what would you do? And so kind of walk through some of those scenarios with that lens on will definitely help you in sitting for that certification exam. But I get my CEUs regularly because I will not take that exam again. It was a doozy. It was probably one of the hardest ones I've taken.
Oh. And Alicia has a question too. I don't think we addressed this one, but in your auditing experience, have you seen where CMS accepts and fully reimburses when documentation includes signature? that are typed in versus electronically stamped?
So, and fully reimbursements. Well, hopefully there is a signature because usually the problem is there isn't one at all. But there are signature guidelines. So CMS actually has a complete um, document that tells you what the signature requirements are for um, a reimbursable service. So I would always start there and making sure that depending on what type of document it is, because some things they're a little loose with, you don't necessarily need signatures at a certain time, and other things, oh, it's a hard and fast rule. And if you don't have it and you don't get it, then that entire, especially on the facility side, that entire case goes bye-bye and there is no reimbursement for it. So take a look at those signature requirements that CMS has published. That would definitely help.
Okay, perfect. And lots of amazing comments in the chat. Clarice just saying how much this presentation has been enriching and how it's been a gift and motivational and
Oh,
inspirational. So the people love you.
oh, well, I try. I try to give what I want to get. So I try. But
100%.
if you're interested and would like to continue the conversation and stay connected beyond today, again, scan the QR code. You can I didn't get an opportunity to put the chat in there, but or the link in the chat, and I'll do that. But scan the QR code and let's stay connected. I do send out a monthly compliance newsletter that, kind of gives some tidbits or gives you some crumbs to follow. So, here's some things they're talking about. What do you see and how does this match up with what's happening in your particular um, uh, organization? And then everyone who signs up receives today's slides and a quick reference guide to the 4 frameworks that you can always go back and reference. So yeah, let's stay connected.
Perfect. Sounds like
And
all the
then,
gems that folks need and want. So thank
yes.
you
And then
for
you can always join us on Saturday mornings at 9 a.m. Eastern Standard Time for the Saturday morning tea, where we talk the real about health information. It
indeed.
goes down.
Indeed. So this has been awesome. Thank you so much, Clarice. I mean, this has
Thank
been a
you.
beautifully structured and masterful presentation today. Our time
Oh,
has been well spent. LaShanta has
yeah.
the T in the chat. She's
Yes.
our time has been well spent, everyone, and we just want to say thank you so much again, Clarice, for joining us today and taking the time to pour out of your expertise and your
Absolutely.
wisdom upon us. We really, truly
Absolutely.
appreciate it. And everyone who joined in today, wow, we are so grateful for your presence, for your engagement. The chat has just been moving today, and we absolutely love that. Even for those who have watched us live on LinkedIn and on YouTube. We're so grateful for your presence and your continued support of the qualified. Guess what, y'all? We'll be back next month, same time, same place, same third Thursday of the month for another brunch and learn. We want to continue to equip you with the tools that you need to go about your professions in the most efficient and effective and successful way. So that's what we're here for. We're here to stretch our brains and provide you with awesome resources to continue your education in the health information industry. So check out the Qualified's website and follow us on social media to learn more about what we have happening and who's going to be our special guest for the month of November. Third Thursday, 11 o'clock a.m. Eastern Time. We'll be right here in the building. So we hope to see you all then. And until the next time we see one another, we want you to keep shining bright and have an awesome day on purpose. Have a great life intentionally, if I could close
Yes.
that. All right. So we'll see
Yes.
everyone next time. Take care. Bye bye.
Bye. Thank you.